Hi, my name is Dr. Mazahery. I'm an orthopedic spine surgeon at Reston, Virginia. Been with the practice for 20 years. And I've been getting a lot of questions recently about AI, artificial intelligence, and its role in medicine. Although AI is evolving and it's extremely exciting to see where this goes, we already are incorporating them. We've been incorporating them for the last couple of years within our surgical field and in the clinic side of things. On the surgical side of things, for years, especially in the larger cases that we do, the deformity cases, the scoliosis cases, the patients who are bleeding and we have to do a larger correction to bring them back up. Oftentimes it was the surgeon in their experience saying, okay, we're going to add 10 degrees here, 20 degrees here, put some wedges here, take some wedges out to correct someone's deformity from what we call sagittal malalignment into a proper position. The good news is over the last several years, as we've now learned what is the proper alignment for someone, what is the right parameters, how much should each disc have as far as curvature goes, where are those curvatures supposed to be, at the bottom, at the top, in the middle. So we have a lot of numbers that we can incorporate. And if we use someone's current x-rays and CAT scans and MRIs and feed that into a computer-based system, a computer system feeds us this is what the ideal parameters of that patient is. So it's AI generated parameters of where they would like the patient to be. And we obviously tinker with that. We look at it and say, okay, this is where the ideal scenario is. What are the limitations of this patient? And how can we get that person into an ideal scenario? The great thing about AI in the spine surgical world right now is that it actually has great technology where once we have those parameters, we can make a custom rod, and that custom rod is made based on these AI parameters. And the custom rods allow us in surgery to get the patient to the proper alignment. Obviously, this is a big surgery and big recovery that we're talking about, but it doesn't have to be this big, could be smaller, could be something different, but allows us to get the proper curvature to your back. And so when I have that rod that's custom made, using these computer-generated numbers, we can come in during surgery and say, look, we're not where we need to be. We need to put bigger wedges in, or take bigger wedges out, or correct this tilt or that tilt to bring the spine to the rods so that we can get the ideal alignment. So in the world of AI, it is changing fast, and we'll see what the next 5-10 years comes. But it's been exciting actually for us to be able to get a more traditional surgery being done more modernly with these technologies so that we can get a more optimal result.